And for more on this, I'm joined now from Bangkok by Phil Robertson from Human Rights Watch. Phil, has the military's crackdown on medics deprived citizens of healthcare?
Certainly the crackdown on both doctors and nurses and also occupying hospitals by the military junta is making it very difficult for the ordinary people of Myanmar to get the health care they need. They have to run a gauntlet of surveillance and control, actually, if they want to go to one of these hospitals to get health care. There are many people who just don't feel safe. They fear going to the hospital that are controlled by the military, especially if they or their relatives have been involved at all with the civil disobedience movement. And we're receiving reports of people who are injured on the streets who won't go to the hospital, get health care, and even cases of people now contracting COVID-19 and getting into respiratory distress and being unwilling to go to the hospitals and preferring to try to wait it out at home and hope that they improve by themselves.
Would you then describe what's happening in Myanmar as a medical emergency?
It is certainly a medical emergency. It is a situation where you already had a weak healthcare system, one which had improved under the civilian government, but was nowhere near the top levels of any of the countries in Southeast Asia. You know, a system that was chronically underfunded, and all of a sudden we're being dragged back into a period similar to what we had during the previous military dictatorships, when the Myanmar health system was one of the worst in the region, if not the world.
But that having been said, Phil, doctors themselves went on strike in February earlier this year to protest against the military. Were they, by their actions, not depriving citizens of treatment?
Well, many of the doctors actually refused to go work at government hospitals, but they set up their own clinics and continued to treat people, often for free. The problem has been that the military has now been trying to find these secret underground clinics to raid them. When they do catch them, they arrest anybody they find there. They have been confiscating medical supplies. So quite clearly, the military junta has prioritized repression of doctors and nurses' right to freedom of expression and right to have a political viewpoint over allowing these people to basically continue to treat those who are in need.
These actions by the military would, on the face of it, seem completely counterproductive when you have a military that's trying to rule a country and then the same military personnel are targeting the doctors that can help society.
Well, I think what you see is a military that only has really one common platform and one common approach, which is repression. They see anybody who is opposed to their takeover of political power as their enemy, and they don't care whether that person's a doctor, an ambulance driver, an emergency medical technician, a nurse, a hospital administrator. They don't care. They see people as their enemies, and they are essentially targeting the people of Myanmar and the medical personnel as enemies. And that is a fundamental problem. That is a fundamental violation of rights, and it's depriving people of their right to quality health care.
Phil Robertson from Human Rights Watch. We'll leave it there for the time being, but thank you so much for joining us today.
Thank you.